Good evening, everyone. Welcome to a joint EmpowHer panel session on leveraging a UC Davis MBA in healthcare. Here is our agenda for today. Before we introduce this series and our panelists, Nikki and I would like to briefly introduce you to each of our clubs. Nikki?
Yes, so those of you that don't know, we have a healthcare council club through the GSM. It is mainly concentrated with MBA members, and we have a lot of Sacramento part-time people as part of our membership, but it is all for the whole GSM. We do focus a lot, like I mentioned, on business models and business practices, but if there's any folks here from the analytics class or even the accounting, we'd welcome you to join our club, and you can either reach out to Becca or myself if you're interested in joining membership. We have a listserv that we send out notifications on for related events and announcements and job opportunities, so we'd be happy to have you.
Thanks, Nikki. And Nikki DeGeorge and Becca Littman, they're co-presidents for Healthcare Council.
Oh, yes, thank you.
Yeah, we forgot to introduce who we are. Thanks, Nikki. So, and my name is Samantha Keough. I'm the president of Women in Leadership Sacramento Club. And Women in Leadership is an independent student club whose mission is to connect and support GSM's future women leaders through professional, educational, and social activities. We are open to all currently enrolled Sacramento MBA students, although our events are open to all GSM programs. We are also always open to receiving input from you, the audience, on the types of events that will add value to your GSM experience. We recently rolled out an official membership program, so please contact our directors of membership, Meg Lee and Mario Berman, for more information. The EmpowHer speaker series is intended to amplify the voices right here in our GSM community, capitalizing on the expertise that our colleagues bring into the program, have built during our time together, and will pursue after graduating. We hope you will enjoy today's session. I want to thank the co-presidents of Healthcare Council, Nikki DeGeorge and Becca Littman, for this exciting collaboration. We've greatly enjoyed working with you and your team. Also, I would like to send a big thank you to the Women Leadership Vice President, Preet Aluwalia, for taking the lead in initiating and putting together this collaboration. Finally, a huge shout out to our Women in Leadership Directors of Programming, Marie Putnam, and Director of Marketing, Brooke Haravia, for their extensive work behind the scenes in working with Healthcare Council and putting together this event, all between, and let me say this, all between full-time work, second and third year MBA courses, and personal lives. So next, I will pass it over to our co-hosts to introduce our panelists.
Thank you so much, Sumedha. So my name is Becca Littman. I am a final year MBA candidate in the Sacramento program and co-president of Healthcare Council. And it is my pleasure to introduce Jen Correa. Jen is a project manager within the Strategic Space Planning and Transition Strategy Department of Lucille Packard Children's Hospital in Palo Alto. She combines her passion to contribute to a mission-driven organization with her project management and healthcare facility design skills through project work to activate new units and ambulatory sites within the hospital, and she partners with clinical leaders on space planning projects. She previously worked for the California Quality Collaborative, or CQC, serving on a 4-year CMS-funded grant to transform clinical practice. Prior to CQC, she analyzed clinical trial protocols for business proposals and managed marketing projects at the clinical trial services vendor Racket. Jen holds an MBA from the UC Davis Graduate School of Management and a PMP certification. She lives in San Carlos and spends her free time with her husband and son. And now I'll hand it off to Anna to introduce panelist Michael Baldy.
Thank you, Becca. My name is Anna, and I am the Director of Finance here for the Women in Leadership in Sacramento. And today I have the honor of introducing Michael Baldy. Michael is currently a UC Davis GSM alumni from the graduating class of 2001. As a panelist today, Michael will be sharing some of his former medical work experience from his time served in the U.S. military as a U.S. Army Medical Service Corps officer and medical evacuation pilot, where he managed medical operations as well as partook in some of the medical evacuation missions. In addition, he'll be sharing some of his medical experience at his current employer, Kaiser Permanente, where he serves as a director of quality, overseeing both the accreditation, regulation, and licensing, as well as the risk management, the patient safety portfolios. So Michael brings a variety of medical experience to share with us today, and on behalf of Women in Leadership, welcome, Michael. And I hand it off for our next panelist to be introduced, for Marie. Thank you.
Thanks, Anna. So our final panelist we're going to have today is my friend Samantha Keough. And so Samantha is a community outreach supervisor with the UC Davis Health. And as a Mexican-American dreamer student, she has taken on 2 cultural identities, which have taught her over her lifetime to value diversity and easily relate to the communities that are not her own. So at UC Davis Health, Sammy assists in the administrative development of COVID-19 vaccine efforts and PCR testing by creating standard operational procedures. She was responsible for leading the first mobile vaccine team to assist the underserved populations across Yolo County. She has also worked in patient accounting at United Healthcare as the main point of contact in analyzing billing adjustments, and was presented the Leadership Award for developing standard operational procedures for her department. Additionally, she led the first employee advocacy and engagement committee to foster camaraderie between the employees and leadership. And through all of these influences on her life, she has used these to drive her towards her MBA, where she is pursuing at the UC Davis GSM with a focus in healthcare. So with that, let's start in on our panelist questions.
Great. Thank you all for introducing our wonderful speakers, and thank you, our speakers, for taking the time to be here. We really appreciate it. So first question, how has the MBA degree or program helped shape your career in healthcare? And then also, how has it helped you think differently about healthcare's greatest challenges? Not a loaded question there at all, or a tough one to start you off with. Michael, why don't we start with you?
Oh, great. I get to lead it off. First off, I totally disagree with that question. There are 0 challenges in healthcare. So no, you know, I'm personally still learning, I guess, how I'm only less than a year out of the program, so I'm still kind of learning how to apply some of my MBA experiences. So part A, I would say, for how did it kind of help shape my career in healthcare so far? The biggest help I think it has, it's been beneficial to me, is being able to look at a system or a process from start to finish, you know, analyze it, you know, find the gaps, bring the right folks to the table to, you know, discuss those gaps and come up with an outcome that's not just best for staff, but, you know, it's primarily best for patients. And there's a lot of, you know, nuance to that in terms of what individual, you know, skills courses, little, you know, bits and pieces I've taken from different things. But that's, I think, if I have to pick one thing that, you know, I've been able to put towards my career now, it's that. And I really thought hard about how to answer kind of the part 2 about this, is looking at the different challenges. I work in an organization that's very, it's very big, it's very complicated. And so, and what I've learned with that and with healthcare in general is we generally move at a snail's pace. You know, well, most organizations, if you're looking at some of the MBA courses that we take through kind of the lens of, Silicon Valley type companies. Those folks are light years ahead of, what people are doing in healthcare and how we're, leading these organizations. So with that, what I've learned to kind of take from my MBA experiences is trying to push, the organization into the future, which sounds, big and lofty, but really at a local hospital, that just means, starting with, the team, my teams that I lead, the teams that I, work with every day. So starting there, because really, not a loaded question at all, Nick. A lot of challenges. So that's kind of where I'm at in terms of my post MBA journey, and trying to tackle a lot of those mountains.
Yeah, they're definitely huge mountains, and that's really awesome insight. Jen, you want to go next?
Sure. Yeah, I would say, I'm going to answer this question kind of, literally, I guess, like it really, the MBA really helped change my career in that I got a job through someone in the program and someone I knew that I probably wouldn't have met otherwise. And that so I probably wouldn't be where I am today without having this relationship, having a friendship with someone who was in the MBA program. I work at Stanford Children's Health, which is associated with Lucille Packard Children's Hospital in Palo Alto. And the person that his name is John, and he was in classes of mine. We're in the same, entering year at GSM in the Bay Area. And I was looking for a new job. I worked at a small organization, healthcare policy organization, which was kind of looking for something new, and had started talking to some people in the program. I'm looking for something new. And I talked to John and I mentioned this, and he said, oh yeah, like there's an opening, check out the website. I know the manager, or like he's had some interactions. He didn't really even know him that well. I know the guy who's hiring for this role. And he really was my advocate. He was like, did you send it in? Let me email him. Let me bug him. Let me bug people who know, like sit near him, and helped influence the decision to hire me. And honestly, like I wouldn't like that helped me get where I am and helped me get in the organization, which was just really where I wanted to be and where I still like to be. I'm still there. So that really changed my career. And I think having the MBA helped me meet John and, people who are in all these different organizations, which is really cool. But also having that kind of credibility, because I do think I wouldn't have been really considered a serious candidate if I weren't either working towards an MBA, which I transitioned to the new career, the new job, like year 2 of my 3-year path. And so I think having that, the fact that I was going to get the MBA was really like appealing to my hiring manager. So, and then the second part of the question about thinking differently about healthcare's greatest challenges, I feel like my career has kind of like zoomed in really more closely on specific problems. Like my past role at this healthcare policy firm, I was in a team that led a lot of trainings about how do you improve healthcare and how do you improve quality. And I felt kind of removed from actually like understanding some of these problems and challenges. And I'm now working at a hospital, and I work on space planning and design projects. And it's like sometimes it feels a little granular, but I actually feel like Michael was saying, healthcare is so complicated. These organizations can be so complicated that it's kind of like important to get to know. I feel like a small piece really well can help attack those challenges. You have a big view, but like you kind of need to really get familiar with like a certain slice of the pie before you're tackling everything. So if that makes sense.
Getting down into the nitty gritty in certain areas.
Yeah.
All right, Sammy, you want to go next?
Yes. Hi, everybody. So being in the MBA program, I think it really just made me reevaluate what I wanted to do in healthcare. And don't get me wrong, I'm still exploring, but I graduated with an undergraduate degree in healthcare administration, and administration is very broad. So I was still coming in, I was very intimidated because some people were, holding big titles in their companies. And I was still, I'm not sure what I want to do exactly. So just want to say, if you still don't know, that's okay. I feel like the MBA has helped me narrow it down, definitely taking things like finance and marketing and operations. Definitely no. I don't want to do certain things. For a while, I was like really open to finance. And then I was like, never mind. I think I can't be alone. I'm more of like a social person. So taking like the leadership classes and everything really opened that passion for like leadership for me. So it has helped me explore more of that. And I still wasn't sure where I wanted to be then, but now I'm still exploring, but I definitely have a better idea and vision of where I want to go. And the MBA program really helped me, as well as just making friends with, your peers. I have another colleague of mine who has the same undergraduate degree, and now we are in the MBA program. And we both kind of just catch up and we're like, hey, what position, are you in now? And then he kind of just tells me like, I'm looking into this position. It would be really cool. And then I'll let him know, what, I'm thinking that I will want to do this. So just kind of like networking and knowing what they want to do kind of helps you and lets you learn about their roles as well and explore those different possibilities. For the second question, what has helped me to think differently? So I think right now, some of us are in the stance of higher ups are kind of making decisions for us in the new COVID world. And then maybe some of us are making those decisions. So I think the MBA program is really challenging me to think, what would I do if I was a higher up trying to make those decisions? And, what are those implications? And I think that's really opening up and preparing for the future. So that's kind of what I've learned in I'm taking the executive leadership class where they come in and talk to us and just kind of sitting in their shoes, just thinking like, wow, that could be us, one of us one day, and really starting to think outside the box. Thank you.
Really feeling what they're possibly you could have to be dealing with and understanding. Yeah, that's awesome. Thank you. So we'll move into the next question. And this is a little specific. So for the program, what classes have been especially helpful in growing your healthcare career? And is there any that you would suggest we might have some folks on the call that aren't necessarily in healthcare, but they're looking to pivot and move into a healthcare field, especially once they graduate. So Michael, is there any classes that you can think of in particular?
We need to make Jen go first on the next question. So for me, the MBA program for me was kind of broken down into the analytics, the hard skills, and then kind of like the soft skills, classes. You have your finance, your stats, accounting stuff, and then it was all the leadership, organizational development stuff. I kind of built my program around just kind of being a jack of all trades. But what I kind of learned in terms of specific classes, and I know this is maybe not quite answering the question, pulling out specific classes, but what helped me was to take classes that built up, what I felt were already my strengths, while still doing enough of the classes in my weaknesses that, I could speak intelligently if I was asked, some sort of finance question. Because I couldn't really pick any specific classes. I think the top ones are, the core strategy class has been extremely helpful to be able to provide that lens to the problems that we're seeing in the hospitals. And then generally, a lot of the stats, honestly, decision making, if I have to pick one class, with Mahul, was probably one of the hardest courses I took, because it was at the very beginning of COVID, we were all online, and doing that online was brutal. I couldn't imagine doing it in a class with him either, but I've literally taken some of those things to kind of provide analytical approaches. But just to kind of offer the recommendation is just what a person much smarter than me told me a long time ago is, yeah, of course you want to be aware of weaknesses, take courses, do, things that are going to build up those weaknesses, but don't do it at the cost of not building up strengths. Strengths are strengths for a reason. So for me, I would say for anybody that wants to go, into healthcare, is just, focus on the strengths, which, take that advice for what it's worth. The person that gave that advice to me was our area portfolio leader, my first boss at Kaiser. She's a fellow MBA, UC Davis GSM alum, and that's just something that helped me in terms of picking classes that have now helped me in my healthcare career.
Yeah, thank you. I think that's definitely some good advice that folks will definitely help them as they move forward choosing some classes. Jen, you want to go next?
Sure. Yeah, so actually I was looking at some of the classes that I had taken and the specifics of them. I really enjoyed a lot of the 1-unit healthcare focused classes. There was one business of healthcare, healthcare project management, and those were like some of the ones that were, healthcare related. So maybe that's kind of, everyone's been hearing like, yeah, you should be taking those classes. I just found them to be so great, like concentrated. There seemed to be like a lot of energy, which I thought was really cool. And we had a lot of small group work and like projects. And for me, it felt like that's where it's at. Like when you can pick a project that you're really passionate about and something you're trying to explore, that can really help you, make progress, meet people who are interested in the same thing, which is like ultimately helpful for your career. I would say I took negotiations with Jim Wilson. I don't think he might be retired by now, but negotiations was really great to be able to practice negotiating with people, because that's something you do at work a lot is, not just like the job offer, but like on a regular basis, especially as you get in your career. And it's helpful to practice that in like a safe environment. And then real estate finance, I'll just like throw that out because that was one that I was like, that sounds fun. And it was, it was kind of like a little scattered, but I currently work in something that's related. The work that I do right now, it's kind of helpful to know. So, it's like, it's a mixed bag, but finding things that sound interesting and finding ways to insert that healthcare interest. I feel like that there's a lot of opportunity. Like I've done different projects like through my MBA career. And sometimes I'd be on a group project and I'd be like, hey guys, let's pick this health insurance company because and people are like, yeah, sure, whatever. I don't care. I'm like, okay. And so that has been nice because I feel like I have a collection now of different kinds of experiences. And it just was really nice to be able to explore things, and it helps you process of elimination at some point, also figure out the type of organizations maybe you're like not interested and you're like, nope, I don't want to do this or this. But so, yeah.
Yeah, thank you. That's helpful. Sammy, I know you're still in the midst of your program, but is there any classes so far that have really hit you that you think are helpful?
Yeah, similar as Michael and Jen mentioned, the 1-unit healthcare classes really just help you narrow down the healthcare community within the GSM community and kind of helps like who are the people you should keep in contact with. I kind of know the people in my cohort who are involved in healthcare. So I'll be like, hey, are you going to take this class? And we end up taking courses together. And it's also easier to pick the subject of your project, because when you're like in random classes, I'm always like, well, let's pick healthcare, but I'm like really biased, versus there, everybody's like, yeah, let's do healthcare. So it's like really exciting. Also, just wanted PSA and announcement, like you can take as well healthcare classes from the MPH program, which a lot of people don't know. I was really excited to do that. Like I really want to take a class from the MPH program, which is really healthcare focused. I haven't had the chance because it is from the full-time program, which means it's kind of like during work hours. But every quarter, I always check if there's any opportunity that I can take a class from them, I will. You just have to look in the handbook. The MBA handbook will let you know which classes are approved, which is really cool as well. And lastly, the leadership classes, because I am a supervisor. Leadership is kind of like psychology. Like there's not one answer to everything. So just taking the leadership classes and discovering who I am as a leader and knowing like, okay, I'm this type of leader. That's why I do this. That's why maybe that employee behaves that way, like that has been very helpful in my supervisor role. Thank you.
Yeah, with that, you're kind of answering, the next question, which was how you've leveraged those courses in your current role, and if you have any advice that you'd give other students looking to do the same. So you kind of already answered that first part of it, Sammy, but is there any advice you'd kind of give students if they're trying to do the same?
Yeah, I've actually, during COVID, because our program is changing very quickly, I've gone through about 7 teams in the past year, changing from vaccine to COVID testing, to changing locations. So that was really hard, especially as a first-time supervisor. You know, I kind of got accustomed to one team and then I got thrown another that was completely different. So there was one team that I was really struggling with. And I literally went into my organizational behavior book and just started like searching stuff like, okay, what can I do to do better? And it really did help. Like we ended up doing an activity where we found out, I think if you guys remember, like found out what kind of personality we had. And we ended up finding that out and kind of changed to more sit down meetings, because we just used to have like quick debriefings at the end of the day. Like I would mostly talk, and that taught me like, okay, they need to start talking too. So I would ask them questions and kind of do started doing one-on-ones with them as well. So the MBA program has helped me a lot with the leadership. Like managing teams has been probably one of the hardest parts of healthcare, because I feel like I have the work ethic to, you know, do the hard stuff like writing down training manuals and all that, but leading a team is definitely takes a lot more work.
Gotcha. So definitely the leadership classes and organizational behavior then. Awesome. So for Michael and Jen, after graduating with your MBA, what advice would you give students hoping to move up at their current or to a new healthcare organization? And per Michael's request, we'll go with Jen first this time.
Sure. I mean, I would say, first of all, like it doesn't have to start after you graduate. I mean, for me, and this is, I know there's might be full-time MBA and part-time, but I switched to a new role during year 2 of 3 during my MBA journey. I think continuing to ask yourself what you're really looking for and what you're really prioritizing. I mean, for me, at the end of the day, I wanted to have some kind of work-life balance. I wanted to work in healthcare. I wanted to work in a hospital or some kind of healthcare delivery. And I think just recognizing how broad healthcare really is helpful. So like kind of narrowing that down. Okay, like is it pharmaceuticals? Is it like I said, working at a hospital, for-profit, nonprofit, thinking about all those different things and being really real with what you want. I think you can make a lot of great, connections when you're in the program. So by the time you graduate, you will, already know the types of companies you should be applying for, or if you already applied to them, or you have already a job lined up. It's hard to say, but that. Yeah, I think that's some of the advice that I'd have on that. Yeah, that's about it.
Gotcha. No, that's helpful. So start thinking about it as soon as you can. Go ahead, Michael.
Yeah, I mean, building off of what Jen said, I mean, I was also fortunate enough to, be in the part-time program, work in the hospital during the program. So, I was able to kind of, start, working towards my, desired job, what I wanted to do while in the program. But in terms of advice for folks, that are trying to leverage their MBA experiences and move up, depending on what kind of role you're in, what the dynamic is, if, you're a leader, a supervisor leading folks, or if, you're an individual contributor, put yourself out there in terms of trying to take on some sort of, project or, some unmet need, and, using those MBA skills, the analytics, the project management stuff, the, building and shaping strategy, whatever it is, to show, to just help, solve a problem that, you folks might know is there. They just don't have the bandwidth, and just showing that, these skills work. I was able to use that with something that literally helped me get into the success on that, helped me get into now my current director roles. And it was all using, for that, I was just using pieces of the different analytics tidbits here and there from different classes to, redo how we were analyzing and then, mitigating risk. Yeah, just putting yourself out there on something, even if it's just asking, your supervisor or boss that, like, hey, what what can I do? That's just, it's something that helped me. And I've seen that help people in other situations.
Yeah, thank you. That's awesome advice. So moving into the next question, what do you enjoy or find most impactful about working in healthcare? And Sammy, why don't we start with you?
Yeah, so I actually wasn't born in this country, so I didn't receive healthcare until I got my first real job after college when I was about 24. And that was like, that was amazing for me. You know, some people just kind of saw it as like, oh, you know, another health insurance. And to me, I was like, I can't believe I have like full healthcare insurance. So what I found the most impactful is helping underserved communities. Working in the COVID-19 vaccine clinic. We did start off in counties. We started in Yolo County, but we went to like Esparto, Woodland, a lot of Spanish speaking populations there. Just helping people that just needed a simple translation or just had simple questions made a huge impact. Some of them had a lot of questions, and the only reasons why they hadn't gotten their vaccine yet was because they had a few questions about the differences. So being like that translator and being able to inform them definitely fuels my passion in helping underserved communities in healthcare. Yeah, thank you.
Yeah, that's really awesome and amazing work. Thank you for doing that. Jen, what about you?
I would say, I mean, I started out my career in advertising. I worked with the sales team to sell basically ads to advertising companies, media companies, and I just like that mission did not connect with me, that end goal. And so ever since then, I've been like, okay, what do I really want? And the mission of the work that I do is really motivating, I would say. We deal a lot with people. We're a children's hospital. We help children. And even though I don't provide direct care, I'm not clinical, like ultimately the work that I'm doing is supporting that mission, and that it makes me feel like I'm a part of something great. And a lot of the work and the way we do our work is like, okay, we have to make sure we do this outside of patient care hours, or we need to make sure we're working with the clinicians who are providing this care, and we need to be mindful that we're not making too much noise, or that we have mitigation strategies if we have construction work that's going to make a lot of noise. So it just seems, I love like the part that we do about like this compassionate care, and I feel like it really seeps into our culture as an organization, is like this compassion, which, wow, like there's companies that you go to and you're like that don't have that. I've worked at other places that don't have compassion, it seems like. And so that's really key, and that's really core, and I love that.
Yeah, awesome. What about you, Michael?
So my answer, kind of my why of why I pursued a career in healthcare. It's super cheesy, but on the surface, I love it because there's a diversity of problems to solve. It's dynamic. No 2 days are the same. I generally like to work surrounded by people that are smarter than me. I like to help them drive for positive results that impacts people's lives. And I think that's where, just like Jen, is there's that purpose in healthcare. It's the reason I did what I did, in the military, my former career. It was something that no matter what, the reason was, we were at war, I could look myself in the mirror and know that, I was doing something that, was helping people, helping save lives. And that just is why I've just continued down that path with healthcare. Again, super cheesy, cliche, but I legitimately love what I do because, Jen said as well, it's like, we're not clinicians, we're never going to be the person that's going to, resuscitate somebody, at least I hope not. Or we're not going to give that life-saving, vaccine, but, if we can play just, part of, delivering that care to people, to human beings, their families, it's just, it's special to me, really is. I'm legitimately one of those people that, and I tell my teams this like every other day, they're probably tired of hearing it. but I love what I do. I love what we do. I love what, our organization does. So, sorry, I got a little off topic there.
No, you're good. Yeah. And thank you all three for what you do. I mean, you both represent very different sectors of healthcare and all crucial to patient care in the long run. So thank you. We have one last question, and I'm kind of going to leave it open, and then we're going to move into any questions from the audience. So is there anything else that you would like to share that you haven't had a chance to talk about yet? And I'll just leave this open in case for whoever wants to go or has something. And if not, we can move into speaker or participant questions.
Yeah, I mean, I can jump in with this. I really think that as I was thinking about the questions, and the one thing that didn't fit naturally, wanted to mention it here, was just really that enjoying this time as an MBA student and getting to know the people that are in your cohort, in your program, the people that you interact with in different ways, even if it's it's your MBA student, it's your peers, but also the people who are around your peers. And so when you're going to those MBA barbecues, it's your, one of your friends' husband or something, seeing that all, you're in this program to learn, but you're also in it to develop relationships. And those are so important. And like I said, for me, my journey was having a relationship with someone that I really genuinely liked, and led into this new role that happens frequently with the MBA program, and just kind of thinking about, like I said, enjoying it naturally and letting these relationships develop. And even though I know you're all super busy and that you're working really hard and hopefully getting enough sleep, not getting some sleep, but also making time for those relationships. So
yeah, thank you for sharing that. That's good to hear. Definitely good to keep in mind as well. Sammy or Michael?
I'm open to questions.
Okay, so we will open it up to questions from the audience. If you have a question, feel free to put it in the chat or use the raise hand feature. And we'll kind of go from there. Yes, Monica. Monica?
Sorry. Yes, I'm here.
Oh,
Sorry.
no, you're okay.
This question is for Michael Baldi. I didn't catch some of the classes that you had said that they became very instrumental. For instance, you were mentioning about project management. The difficulty that I'm having right now is how do I work for the state, and I've been there for almost 11 years. And so I'm trying to put into practice things that I'm learning as I go along. And I reached out to a couple of people from my cohort, but it was not a successful attempt at trying to gauge and get ideas on how to implement and improve training at my job. And so I wanted to just kind of find out, I know that you mentioned the classes like in project management, and what other classes were you mentioning? I'm sorry.
So I think there's a couple of courses that were mentioned. They were just, the healthcare specific ones. I know the one unit's like the project management in healthcare. There's a healthcare analytics, and I think there was one more. It may or may not be offered anymore. But those were just some of the healthcare specific, and I think what the other ones I mentioned were like decision making, which is more on the analytics side. Business of healthcare. I think that one was one of them, which was it's I don't know if they teach that one anymore, Jen. They Christy Bird moved on. I don't think anybody backfilled that. Christy was great. So I'm trying to think of other specific courses that, I mentioned that might help in your situation, but
So I guess let me ask you, so it's okay, like for instance, for me to reach out to my upper level management and kind of engage them and give them the idea of what I'm trying to improve, because I was apprehensive. I was thinking I wanted to go to them with more concrete, a roadmap or like a plan. I didn't want it to sound like I was dumping all of the hard work on their lap. I wanted to sound more knowledgeable. And I think that's where I'm at right now. I'm at the place where it's like, ooh, I mean, do I just engage my upper management with an idea and see whether they would be willing to nourish and see me grow? Or should I be coming to them with something that sounds more, that is going to make me look obviously much more well put together?
Yeah, I mean, I think what helped me, I think I hear what you're asking. What kind of, again, just my own, personal experience with this is what helped me was to present something that I knew was an unmet need. And, the how you present that, I mean, that can be very, very difficult. I think that's where, like Jen talked about, those negotiations we learned in Jim Olson's class, some of those, soft skills from those courses definitely help. But again, I think what helped me is that it was something that I knew was meaningful to my leaders or, some of my key collaborators. And I presented it in a way that, it demonstrated the immediate or the potential, at least, for the immediate kind of value added. Again, not knowing, what kind of, projects or work you might have that would meet that. There's a variety of ways to do it. I kind of, for me personally, I presented it as part of our, quarterly meeting. Outside of conversations, obviously, I had with, key stakeholders prior, but in terms of like the initial, like, oh, by the way, we're working on this. We presented it, as kind of like an add-on at the end of one of our quarterly meetings, and kind of showed, like essentially current state, a little bit of the, kind of gap analysis, which again wasn't really a surprise to people, and then just showing, what potential future state was and could be, and that kind of was the the blessing from executive leadership, essentially, to kind of, like, this sounds great, move forward. And then with that, it's always the, hopefully you have like a champion that can support you to help remove roadblocks, or otherwise, you get that champion then for whatever, that project is. So that's kind of how I went about, specific example I had, but I hope that helps.
Thank you. Yes.
I'll just mention too that I took this particular class. It was called, just looking it up, it was called like $4.99, but I think it's basically like you can pick a professor and do kind of like a project with that professor. And I had picked something on like improving parts of the culture at Stanford Children's. So it was with my boss. I got my boss's approval and sign off, and worked with the professor, worked with Gina Doko, and would like I think we met every week or every 2 weeks during the quarter. And we kind of had like a defined, course content, and she would kind of help lead me through this project. And it's been a while now, but it was really great, because if you wanted to get permission to work on something with your leadership, this is a great way, because you're getting you propose a topic, you're getting their review at the beginning of the quarter, and then you get this opportunity to have like another set of eyes to look at developing something. And even not even where it goes, like you showed, and you took this initiative, and I think there's something to that, but also getting a chance to explore the topic. So that's something that you can kind of create and delve into whatever topic is the professor is okay to sign off on, really. But there's a lot that you can choose that's not in the course curriculum.
Thank you.
Becca, why don't you go next?
Thank you. So I have a question about that I'd like to hear from each of you on about battling burnout. Especially, I find as a mission-driven, purpose-driven person in healthcare, it's really hard for me to step away and to take breaks and to take care of myself. So I'd love to hear from each of you about how you kind of manage to find that balance.
Yeah, so something that I did as a supervisor was during the Omicron breakout. It was crazy, as you guys know, there was like hundreds of people. We used to kind of rotate our breaks, and it was kind of like a thing where some of us would just say like, oh, you know, I never take my breaks. And I was one of those people as well, especially as a supervisor. So we kind of just drafted this idea about just shutting down for break the entire building. That way everybody took their break and nobody had the excuse. So we started doing that, and I loved that as well, because I was finally able to take a break. I was finally able to go eat a snack. There'd be times where I would go the whole morning without eating. So it definitely is important, and it's always easier for me to tell someone else than do it to myself. So the fact that that was implemented helped other supervisors as well finally take our break so we can, you know, step out for a quick 15 minutes. Makes all the difference.
My department, so my manager has a policy, or like unofficial policy. If you have more than 100 like paid time off hours, vacation hours, you really shouldn't go above 100 on a regular basis unless you have like a trip planned. And, you know, first I was like, that's kind of silly, but it's great because she really encouraged us as a team to take PTO. And when I joined the team like last April. And that was like one of the goals. I think it was like a quarterly goal or something, or maybe annual goal. It's like everyone had to put PTO on the calendar. So it was like, okay, you know, the next 3 months are coming up. Like, what vacation are you taking? Where are you, you know, you're taking your PTO days, you're taking your hours. And I thought that it was really great. And I really do, we try to look ahead as a team at least like a month ahead. And I'm actively like trying to put PTO days. And it's a nice thing to get into, because you kind of say, okay, I'm going to be on vacation and I'm going to take my vacation and I'm going to be offline. And so something to look forward to too.
Yeah, I mean, Becca, as you can see, I'm still in the office, so I don't know if I'm the best person to answer this, but I'll you know, it's kind of two things. Is one, it's like, you know, how do you manage burnout? Or for me, it's how do I manage burnout for my, you know, my staff, or, you know, the other departments that, you know, I support, my team supports, and then how do I manage my own personal burnout? You know, I think Sammy hit the nail on the head in terms of you have to model the behavior that you expect from your staff in terms of taking breaks, you know, taking a knee, being like Jen said, if you're on PTO, you are like, no one reach out, and also not, I used to have a bad habit about this of responding to emails or doing work on my days off. And it's just like, you know, Mike, why are you like, you're off. So modeling those behaviors, you know, and then it kind of goes deeper with my current role, you know, for staff, because at least a lot of patient safety risks when, you know, just staff in general are burnt out. But I'm still learning how to, you know, deal with it, you know, personally, and to actually, you know, model those behaviors. And so, yeah, I have no suggestions there, but just echoing what the, you know, others have said, at least for, you know, managing it with people you work with or, you know, work for, is, you know, model the behavior you want them to do.
Thank you.
Samita, did you have a question?
Yeah, sorry, I'll have to switch modes now. But great question, Becca, and thank you, panelists. My question has to do with, for those folks that are looking to switch into healthcare, what can you guys say about going the path of getting a job within healthcare, or going the path, you know, in healthcare, there are things called administrative fellowships within several large entities like Kaiser, and I think several organizations have those types of administrative fellowships, which are like 1 or 2 year programs, which are essentially like training, and you do projects and you rotate. So could you guys speak to that and just the avenues, the strategy, pros and cons of how to enter healthcare?
I mean, I can, unless some of the panelists want to go first, I mean, I can speak to Kaiser. Just locally, and they haven't had it through COVID just because of it's COVID, but you know, there's an internship specifically, you know, built for you know, the GSM essentially. You know, it's open to all grad students, but you know, they recruit heavily out of the GSM. Up until they stopped it, you know, at the beginning of the pandemic, I think of 5 people that I know of that went through that internship. 4 of those are you know, working for the organization. So I say that just to say that generally those programs, whether it's the internships, the fellowships, they lead to jobs. So if you're, you know, especially if you're a full-time student, or even if you're a part-time student, want to, you know, pivot full-time, you know, into, you know, a job, and I'm speaking from Kaiser's perspective, they're great programs. I came on board through a similar program as well, and it's really no tips or tricks on how to actually kind of get into those. You know, it's the recruitment process with, you know, big healthcare organizations, especially Kaiser, you know, feel like a black hole when you go to apply, but you know, leverage, you know, the network. I get pings all the time about, you know, different postings for Kaiser, you know, to at least answer like what actually is this job, you know, because we have our own language in terms, and a role that you think means one thing or would mean one thing to like everyone else in every other industry means something completely different here. So yeah, getting a little off topic about kind of the internships, the fellowships, but they're fantastic. You know, if that's an option for you, pursue it. You know, if you need letters of recommendation, or, you know, you have questions about it, I mean, you know, ask me. I know, you know, folks I can not necessarily won't come from me, but, you know, connect you with that can speak to those programs.
And I can speak to Stanford Children's Health actually, because yes, we have an administrative fellowship program. I have worked with, I feel like at least 3 of the fellows, because we had, they would rotate like I want to say every 6 months. So they have in a 2-year rotation, 2-year program, 4 different roles within the organization. And just really like a great group of people. They, you know, getting on these rotations, you get to sit in on all these different types of meetings. And I felt like the fellows that I knew had such an interesting perspective, because they'd be in like all these meetings and they had gone through different parts of the organization. So they would really have like a kind of like more comprehensive picture of how things worked than I could in the future. I mean, you just get up to speed really quickly. And so I would say definitely, I think it's, I mean, Stanford Children has a really great program. So I would very much recommend that. And I don't know too much about it now, but I know people who have gotten in. And so I could definitely share that information. If someone's interested, I can, you know, find out more information and share that, because yeah, it's a competitive application process, but I think it's so worth it to apply. And I think, you know, all the people that I've known, they've gotten some kind of role, interesting role, manager role, like after the 2 years. So seems pretty interesting.
So for UC Davis Health, I got the advice, and this is how I was able to enter as well, was through TES, which is temporary employment programs. They kind of have like a pool where you can enter. So that's where I started off. And they do usually seek people for full-time careers from there. So fortunately, my position was only supposed to be about 5 months. Here we are, 1.5 years later into the pandemic, and now I became a career employee. So entering that way would probably be a good way to get something in UC Davis Health. Even if you're not in healthcare, I know a lot of the time they just look for like administrative skills or customer service. That's how they hired through my position.
Thank you. Monica, or
Yeah, I'm sorry, Sammy, what was the name? Is that temporary?
TES, which is Temporary Employment Services. So you can look up TES on the search under UC Davis Health and all those positions will come up. So as mentioned, the con is that it's temporary, but a lot of the time, like once your assignment ends, that position, that department can like consider hiring you, or if not, they will place you in another temporary position until you can either find a career position in UC Davis, you can keep applying internally, or they hire you in that department.
Thank you.
Jennifer, did you have a question? I think we have time for one last question.
Hi, everybody. This is Jennifer Tucker. I'm with the Career Development Department. And I just had a quick question for each of our panelists. If you would be willing to share what you do for professional development and networking.
So for myself, I know UC Davis Health provided career services. So I did contact them, as well as I've met with you, Jennifer, to get advice on like how to improve my resume or how to network, because even networking is kind of difficult. Because, you know, you don't just want to go up to someone and be like, hey, like I need a job. You know, you want to learn like how do you ask questions or how do you kind of make that relationship. So using your resources, definitely do it. Also getting in contact with certain individuals. They'll know like certain recruiters or other people within the organization that can help you, and just have a meeting with them, just ask them questions, and that will usually, you know, build a relationship within those people.
I'll jump in. So for professional development, I mean, at this point of where I am, it's pretty targeted, the types of organizations I'm in, but so I got a PMP, the Project Management Professional Certification, during the beginning of the pandemic. I was going to take it in, I was going to take the exam in person in March 2020, and then that kind of got changed, but ended up doing a web test, like an online test in May, and passed that. And so like the PMP has become a big part of my career, and I'm a project manager, so that's gonna be my like little plug for getting a PMP. But the community, there's a really great community in many, well, actually they have like lots of local communities, but the project management community is really great. And there's all these like local chapters. So there's a Bay Area one, Sacramento one, like they're all over the world, United States and world. And so that's a great way to meet people. Even before I got the PMP, what's cool is that you can go to the events, and I think they're all virtual right now, but you can meet people who are wanting or, you know, curious about the PMP. I always met a ton of people who are in healthcare, different parts of healthcare, a lot of UCSF, Kaiser. So that was kind of interesting. And then the other thing is that I'm part of the healthcare design organization. It's Healthcare Design is the name. I think that's the official name. But they have a conference. Used to be, yeah, in person in 2019 was the last one that I went to. But that organization, they do a ton of webinars, and they're starting to do like virtual events and virtual parties. And that's a great way to meet like-minded professionals. And a lot of those types of groups too, you can become a member, you can show up to the events, you can kind of get a feel for it. And then you don't have to like, you know, most of the time you don't have to have that degree per se or that certification or whatnot, but that's a great way to meet those types of people. And then, you know, have a conversation. A lot of people are open to having like a coffee or a chat and talking more about their career trajectory and all of that.
Yeah, you know, one thing I've learned is that in general in healthcare, I don't think this is a Kaiser specific thing, but they love letters behind names. So different certifications. So that's kind of where I'm currently at in my career in terms of professional development, is pursuing some of those certifications, you know, that align with my, you know, current job, job I want. That being said, you know, in the middle of grad school or, you know, fresh out of grad school, you might not know what exactly you want to do in healthcare. If it's going to be, you know, kind of the PMP side, the, you know, Six Sigma side, the, you know, the Scrum Master stuff, or if it's, you know, more on the the patient safety, risk management. There's dozens of different certifications or things you can do for professional development that add those, letters to your signature block, which for better or for worse, a lot of healthcare leaders, they like to see that because they have those and they want other people to, have them. I don't know, but that's just something I've learned. So that's where I'm at is, I could, maybe pass on the recommendation is just, look into certifications in the areas, you think you want to, focus on in healthcare. And in terms of networking, I mean, my networking is still primarily with the really folks I work with, within my health system and really my GSM cohort. I'm constantly, in contact with folks, that, friend of a friend within the GSM of like, hey, talk to Michael about, Kaiser. So stuff like that. So utilize the GSM network. I mean, there's a lot of, GSM alums that are, in these organizations, all over the North State. So, yeah.
Great, thank you guys so much. With that, I'll turn it over to Samita to close this out.
Okay, thanks so much. Thanks, Nikki. Thanks for facilitating, and thanks panelists for a very engaging session. Jen, I liked how you highlighted the mission-driven focus of healthcare and that we know compassion is essential. Sammy, I liked how you highlighted the population health and health equity aspect of healthcare as well. And Michael, I liked how you highlighted the opportunities in healthcare to step outside of your roles, take on leadership roles, project management, to increase your leadership skills. So again, and also I would like to thank the audience and the Healthcare Council and Women Leadership teams for putting together this event, and wishing everyone a good night. Thank you.